All of our work and all of our priorities that you'll hear people talking about and you'll see examples of are really focused on saying, how do we make the services sustainable? How do we make sure that we can afford them going forwards with a real focus on working in the best interest of the population that we serve. And the team are really powerful in terms of saying, how do we put the patient at the centre? How do we put the person at the centre? Have a real focus on making a positive difference in terms of what we're trying to do.
When I talk to patients, what they want is they want care to be more joined up. They want care that helps and supports them to reach their aims and goals in life in a joined up way. Connecting Care is much bigger than just a health focus. It's about strong, resilient communities. It's about empowering people to look after their own health and be involved in their own care. It is about joining up care. It's also about making sure that we get things right first time, and it's about making sure that we spend our money wisely.
The patient experience, the patient voice is vitally important to the kind of health service that we want to provide within the clinical commissioning group area. My role is that of a normal patient, a member of the public, and I bring the public face and voice to the clinical commissioning group decision-making process.
The way in which the whole sort of patient experience has been dealt with, from my own experience and from my husband's experience, has been very good. Referrals to the hospital and so on have been very prompt.
We all work together for one main objective, so that patients understand and get a better understanding of how the system works in order that they can have an input into it.
It's about being patient-centred, ensuring that when we're taking decisions about people, that there's no decision about you without you.
The relationship that the police officers and my practitioners have with service users in the community now has got to benefit by the fact that they're working together. The partnership that we've been able to create with the police officers and the mental health nurses it's worked really well. They're able to bounce off each other's professional backgrounds, so when they're visiting service users at crisis, people with mental health issues or learning disability, we've been able to have an approach that has helped foster a relationship with that service user on a pathway that has previously maybe been difficult.
Street triage's essence is an immediate response to a point of crisis, suffered by an individual that turns to the police for support for whatever reasons, their own personal reasons, and they get that service of a police officer and a psychiatric nurse. More often than not, the police officer will step back and allow the psychiatric nurse to carry out that assessment in a timely fashion with a better outcome, a quicker outcome and a far earlier intervention than they would have got if it had just been Cheshire Police in isolation.
Working with our GP membership and the wider practice, we constantly seek to look at ways that we can come up with innovation and develop new schemes. Sometimes practices have particular problems, and at the moment we've got some practices who are really struggling with access and their patients' perception of their access. And so we work closely with practices to help them to understand what the demand is from patients and how they can make the capacity that they have within their practice to meet the patient demand. We'll work with practices to understand how they can support themselves to ensure the patient gets the best experience that they can.
We set up a nurses' council to gather the nurses together. Before the council, nurses have worked in isolation. We have no means of communicating between the practice nurses. The membership council has provided that forum for the nurses to share practice and policies. It is all about sharing good practice and making sure that we're all working towards the same goal around providing holistic care for patients.
So the CCG is a really good place to work because we have a very small team and a very close-knit team, so we do know how each other works, who we need to link in with for different work areas.
I really enjoy working in the CCG because I live in the local area and I think you can see all the commissioning decisions that are made in this area and see them in practice. I feel really valued working in the CCG. I feel that my opinion is taken into account and looking at new ways of working. We do have a lot of fun, but we do a lot of work as well.
worked really hard to make sure that actually we make sense for the central Cheshire population that we serve. So worked really hard to have a shared management team, that our clinicians work jointly across the footprint and across the agenda. The valued-based approach towards healthcare is lived within both CCGs, and our staff are real great ambassadors in terms of that. And that's why, from my perspective, it is a real pleasure to be doing the job that I do.
I'm really proud to be part of something that's making a difference. What I see is people working really hard in a very dedicated way to work differently to make a difference for our population. And yeah, that makes me really proud.